Now the hormones that are acting on our kidney they're very important to know, because these hormones are very important in maintaining the acid-base balance in our body. First hormone that act on the kidney is aldosterone, right? As we have studied earlier, that it is secreted by the adrenal gland, right? How it acts when there is an increased plasma potassium concentration. It maintains the acid-base balance. So when there is an increased potassium concentration in the plasma, and it is secreted in response to decreased blood volume, right? And what it do, it led to aldosterone led to increase sodium resorption. But do increase sodium resorption. What resorption is? It is it excretes the product from the tubular fluid of the kidney and return it back to the circulation, from tubular cells back into circulation. That is how aldosterone act. When there is a decreased blood volume, the signal sends to the adrenal gland to secrete aldosterone. Aldosterone comes and it causes the increased sodium resorption and increased potassium excretion. Right? Secretion is into the renal tubules, and it excretes out of the body via urine. Right? This is how aldosterone acts. Other hormone that act on the kidney is Antidiuretic hormone. Antidiuretic hormone, it is secreted in the posterior pituitary, and it secreted in response to increased plasma osmolarity. When there is an increased plasma osmolarity, there is an secretion of antidiuretic hormone, and when there is a decreased blood volume, antidiuretic hormone secrete, and it causes the increased number of aquaporins to open and increase hydrogen resorption. What it causes? It causes increased water reabsorption by opening of the aquaporin channels that are located in the collecting duct. Right? Other hormone that act on kidney is parathyroid hormone. How parathyroid hormone it is secreted in response to decreased plasma calcium, as it maintains the concentration of calcium in our body or in our blood. Decreased plasma calcium, there is an increased parathyroid hormone secretion, and it causes the increased calcium resorption in the distal convoluted tubule. Increased calcium resorption at distal convoluted tubule. Right? The other hormone that act is Angiotensin 2. It is secreted in response to decreased blood plasma. Decreased blood pressure, it is secreted. It causes the efferent arterioles constriction. When there is an increased efferent arteriole constriction, there is an increased GFR. Increased efferent arterioles constriction led to increased GFR. Right? Other last that act on the kidney is Atrial Natriuretic peptide. Atrial Natriuretic peptide. When does it secretes? When there is an increased blood pressure into the right atrium, right atrium stretches above its normal condition, it sends signals to the kidney to increase GFR, and by this is maintained. Secondary response to increased atrial pressure. The right atria secretes this and causes a kidney to increase glomerular filtration rate to maintain the blood pressure into our blood. It is secreted from the heart. Angiotensin 2, it secretes from decreased blood pressure. This is all for the hormones that act on the kidney. These are the all hormones that act on the kidney. Number 1 is the aldosterone, the next antidiuretic hormone, and then we have